For people with cancer, fighting the disease is priority number one, but sometimes the treatments come at a cost to a patient's heart. Meet a doctor at Munson Medical Center who is only one of 3 in the state who specializes in treating these patients. It's today's MedWatch report.
You have to, you think you never know what the future is going to hold, but you kind of have to live like you're going to live forever.
Wise words from a woman who has faced death a lot recently. It started when doctors diagnosed Angela West with breast cancer in 2014.
I was diagnosed with stage 3 breast cancer. It was considered triple positive, which was a very aggressive tumor with a high rate of recurrence in my left breast.
Doctors soon realized it had spread to her lymph nodes. She needed surgery and aggressive treatment. That treatment put her into heart failure.
I was feeling very, short of breath, wouldn't sleep very much at night, wake up gasping. I had been getting the echocardiograms regularly and nothing had shown as a change right away.
Angela was a little unique in that she got quite sick. Despite getting the proper monitoring, her heart muscle function deteriorated very quickly. So she was hospitalized with heart failure, had gained a lot of fluid weight, and was quite short of breath.
Thomas Andres is Angela's cardiologist. He has a special interest in cardio-oncology, or working with the heart issues of cancer patients. It's a relatively new field.
Well, in the last 15 years or so, there's been a bunch of new drugs that are out now, which are very, very effective in treatment of various different cancers. Unfortunately, a subset of those drugs also have off-target effects which affect the heart, meaning that they kill cancer cells, but they also can cause cardiac dysfunction.
That typically only happens in less than 10% of patients. Angela was one of them.
But there are certain issues that come up in cancer treatment that are relatively unique, and most cardiologists don't have tremendous experience.
The fine line is finding the appropriate strength of treatment while preserving a patient's heart. It's not easy and takes a lot of monitoring, but these doctors are now all working together.
I think there's a confidence level that a patient has if they know that a cardiologist has some knowledge of their cancer, which is usually the most important thing to them at that point, and that cardiologist is going to be communicating directly with the oncologist and working together instead of having fragmented care.
After 2 to 3 months of therapy and working with Dr. Andrews, Angela's heart is back in the healthy range again. Her cancer treatments are back on track, and she's looking forward to the future.
It's been a struggle, but it's, I feel like I'm seeing the light at the end of the tunnel and getting there, so I'm looking forward to the end of it for good, hopefully.
For MedWatch, I'm Michelle Dunaway.